Hi, Chris. Welcome to Revitalized Womanhood. I'm so excited to have you here today with me on the podcast.
Thank you for inviting me.
Yes.
Appreciate it.
Chris is a PA at Nulevel Wellness in Gilbert, Arizona, who, let me tell you this, listeners, first of all, if you don't know, they were so generous to not sponsor, collaborate, donate. There's a good word. Donate some goodie bags for our very first live event we had in Scottsdale the other weekend. And I'm not talking about little bits of 10% off or $25 off a service. It was like facials, ladies. I'm really, really sad I didn't get to come have mine, but I'm already getting ready to book another trip so that I can come in and get all the things done.
Absolutely. Everything that we offer. It's kind of a one-stop shop here.
So, Chris, tell me, you are a PA, you're a physician's assistant. Just tell me a little bit about yourself and what you do there.
Well, my background, so I attended the University of Iowa for PA school, and that program I loved because it was integrated. So we actually went to all of our classes and all of our groups and everything with medical students. So we weren't separated in any aspect of our training. And then all of our rotations, et cetera, were with medical students. So they treated us the same, which was great. After I finished, I came back to Arizona. I am a native from St. John's. And I kind of just wanted to start out doing family practice, but after doing some interviews and finding out that you didn't make very much money at all in family practice, I kind of ventured out. When I was at Iowa, I really admired the professors that practiced and taught the urology section of our lectures. And so I reached out to a urology group here in Mesa and interviewed and was offered the job the next morning. And so for the last 19 years, I have been doing urology, primarily the hormone management side of that. And then about 7 years ago, I was part of a practice where we also had a wellness center. So in that part of the wellness center, I was doing testosterone management and hormone management in males and females. So, and then this just kind of blossomed into a full functional wellness center where we do hormones, weight loss. We have our aesthetics division, and then we do a ton of IV hydration. So we do in-house IVs, and we have a mobile division that will go to people's houses to administer IV hydration.
That's awesome. I actually just saw that on whose Instagram account was it? She just had a baby, and she had people come to her home, and she and her husband were both getting IV infusions in their own bed. I was like, oh,
absolutely. It's amazing.
That's so nice.
We offer 16 different IVs based on the condition or your symptoms. So we have one for just about everything.
What a service. Well, so you're going to have to dumb things down for me because I'm not a trained physician, obviously.
Sure.
But I would really, really like to jump into and talk about the things that really are hot topics for women. I feel like across the board. Obviously, ladies, I'm not throwing the net over everyone. These are not everyone problems, but I think I have a lot of sisters. And I think for the most part, these are common things that we stress about. So for me, I will personalize this and then maybe hopefully everybody's getting it. But I want to talk about mom rage. I want to talk about brain fog. I want to talk about low libido. And these are all things that are coming on tail end of, so with my first two babies, I have 3 boys, and my first 2 were together, and I had them in my 20s and 30s. So then 6 years later, I have this baby. I'm now 40, and I never experienced postpartum at all with my other 2. And with this one, I did, like to the point where I was thankfully nothing dangerous, but I remember and it was an emergency C-section. So that was the other thing. So it was like boom, boom, bam, like taking me out from the knees. But so I didn't know if that had to do with what I'm experiencing now, or it just because I'm older, those things are happening naturally because of that.
Right.
So I know I just word vomited a lot on you. So
no, that's totally fine. So, when in our clinic, we have obviously a variety of different people who walk through the door who, excuse me, who have differing complaints. Some, like you just said, we have moms of all ages, newbies. We have moms we have one that has 10 kids who have come in for hormone management. So they'll walk in and they'll say, hey, I am interested in weight loss, but primarily I want to make sure my hormones are okay. And so that's a big driver for us. We get a lot of referrals from patients who've been losing weight, who have had hormones corrected, to walk in the door to, I just don't feel right. Something's off. I used to be able to get 1,000 things done, and now I can only get 5 things done in a day, and I just feel like I'm never getting ahead. And so we'll talk to them about your primary hormones that we offer as far as getting checked immediately here in the office. We get back next day results, and so we're able to offer a full hormone panel. So in our full hormone panel, we're making sure that people aren't anemic, that some of the tiredness isn't from just low blood counts. We're making sure that testosterone levels are normal. Testosterone in females, it drives energy. It drives so much more. So mood changes, motivation, emotions can be up and down when testosterone isn't normalized and optimized. Memory. We have a lot of people who walk through the door who say, I cannot remember things that I'm supposed to. And I'll say, well, when's the last time you had just your primary hormones evaluated? On top of that, we also check progesterone and we check estradiol, your estrogen levels. So those combined together control so much in both men and women that that's where we start. I don't care if we're after weight loss or if we're just after energy or if we're after straight up libido complaints or changes. A basic hormone panel is where I think most people should start. We need somewhere to begin and then know where we're going. So, and then the other thing that I always suggest is a thyroid panel. A lot of people do just a screening with a TSH, a thyroid stimulating hormone. And I would say that's okay, but there are so many other disorders or components to the thyroid that I wouldn't do just a TSH. So in our basic lab work, we also recommend that patients get a T3 free and a T4 free, and we screen for Hashimoto's. So we have thyroid antibodies also ordered. So I think it's important that people go after everything on those couple of basic panels that we offer. And then we can give recommendations as soon as the next afternoon, which is great. People don't have to wait 1 to 2 weeks. We can essentially the next late afternoon or the following morning after that, have you back or do a telemedicine consultation and come up with a plan based on what we have to offer.
That's amazing because so in the last, I don't know, even maybe I'm going to say 15 years, I've heard women of different ages, because I do have friends that are older than me, complain about thyroid issues, or they've had their levels done and they're normal because they're on this normal range. And there's and one of them actually, yes, she has Hashimoto's. My aunt just got diagnosed with Hashimoto's, but when they went to the original doctor, they're like, you're in the range.
Everything was fine.
Yeah, you're fine. You're in the range. Well, do they tell them that the range is like from 0 to 9,000 and you're inside there somewhere? It's
in your 10.
Like the biggest range.
Yeah, I that's one of the things I like to make a point of, and you can ask any of my patients that come in for consults. We'll talk about normal values, like on testosterone for men example. Low normal is, depending on the lab, is 2 to 250 and high normal is 1100. Well, what if you come in at 299? Your primary care is going to look at that and say, go home. Like, I don't want to deal with this. But if you're 30 and your testosterone is 299, you're going to feel like crap. You're not going to sleep well. You're going to be moody. You can't remember anything. You're working out in the gym, busting your hind end, and nothing is happening. And you're getting frustrated that way. And now my libido's in the tank, and my wife and I don't want to do anything because I have no desire, and now it leads to marital issues. And so I tell guys, no, I want to make you the 95th percentile. So you're 299, I'm going to put you at 900, and your life is going to change. It's going to completely be different in a few weeks. So, and same thing with the thyroid. Yes, your TSH is normal, but your T3 free is at the 10th percentile. Your T4 free is at the 25th. Why don't we move those up to the 85th or the 90th and see what that does for you? And invariably, I mean, everybody always comes back and says, what a difference. Like, I can't believe that I was just told everything was normal and nothing got addressed.
And also, I didn't realize until I had talked to my sister about it. And my little brother, he actually does this same thing. He does this. He's a nurse practitioner up in northern Utah.
Oh, okay.
So,
cool.
My sister saw him and she's like, I'm taking testosterone. And I'm like, what? You're taking testosterone? That's for dudes. You're going to turn into a guy. Like, what are you doing? And she's like, no, dum-dum. Even women need testosterone.
Yeah, absolutely. It's a primary hormone in females. I always talk to females about, the dose that you're going to get if you go on testosterone is about 1/10 of what we give guys, but it drives the primary weight loss and mood changes and stuff in females just like it does guys. We're just going to give you a lot less to get you those same results.
So for men that are taking testosterone, just because like it's so funny, the things that you're so aware of when you hit certain ages and your friends are all in those certain age ranges. But I know a lot of people who are taking testosterone. And what are the dangers? Well, I know one danger of the man taking too much testosterone is he just made it so he's trying to be on the same level with his wife, and he just made it so they are nowhere near on the same level with his wife. But how do you encourage people to make sure they're checking because is it like, here, try this little bit, and if that's not feeling good, up your dosage, or what's the protocol there?
Yeah, kind of what we do is at that initial consultation, we will have your labs checked, and then the numbers will come back. And then based on the values, I usually have suggested starting doses for whatever regimen. So there are 4 different ways that we treat testosterone. One is pellet insertions. We can do bioidentical therapy with pellets. There's testosterone injections. Those can be once a week or twice a week. We have testosterone creams or gels that you can rub on the skin every morning. And then we have testosterone troches. Troches is a sublingual option. So it's a little pellet that you pop in your mouth every morning while you're walking out the door. In 3 to 5 minutes, it's dissolved and it's in the bloodstream, and there's your testosterone delivery. I always recommend for patients to be on testosterone for about 90 days. At that point is when we redo labs and say, okay, it's been 90 days. How are your symptoms? Do you have more energy? How's your gym workouts? Are you recovering better? Memory, focus, all of those symptoms are reevaluated, and then based on how I'm feeling and then the numbers on the paper, hey, this is where we're getting to now, we make adjustments. So nothing ever is set in stone. And I always tell patients, hey, pick the treatment that you think is going to work best for you, your schedule, your lifestyle. And if it's not working, we'll pick something else in 3 months and we'll make it better. So we'll change that to fit what we need to do. There are some places I know of, especially here in the Valley, where they give a guy a dose and it's every guy is the same dose, no matter what their numbers are. And that's thyroid, that's testosterone. And I hate it because everybody is different. Everybody has different needs. Their body metabolizes things differently. So labs need to be checked regularly, and dosing needs to be adjusted accordingly. So
what did you say, real quick, go back on those 4 things you said, because I've never heard of 3 of them. I've only ever heard of the injections. So you said the one pellet and the other pellet. So the creams is obvious, but the first pellet thing you said, what's the difference between those 2 pellets?
So the first one is a bioidentical pellet. So it's a little bit larger than a grain of rice, but it's your testosterone packaged in a pellet that we put in underneath the skin. So this is actually an in-office procedure. It's a procedure that you'll come into the office for. I'll have you in the procedure room. You'll be on your stomach. The top of the buttock is exposed. We cleanse the skin. I'll inject a little bit of lidocaine, probably about 3 cc's. And I take a scalpel blade and I go straight in and straight out. So the width of the incision is only 3.5 millimeters. So it's not very big at all. And then we take what's called a trocar. It's a pointed tube that's hollow inside. We put that into the subcutaneous fat, so the fatty part of the buttock. And then we undo the middle of it, and it leaves an open tube there. We drop a pellet inside of the tube. We push the pellet into the fatty tissue, remove the trocar. I put about 4 steri strips over that incision to make sure that it closes properly. A 2x2 gauze over the top, and Tegaderm, which is that thin plastic to keep it dry and protected for 48 hours. And then that testosterone is good in the female for the next 4 months. So for people who are too busy to remember, for people who don't want to do injections, they're afraid of needles, etc., it's a great option. I had a flight attendant in here this morning, actually from Seattle, whose husband's business is being transferred here, who flies in every 4 months, pops in, I put her pellet in, and she's out the door back on her caseload for her airline. And it's easy for her. She doesn't have to worry about doing anything daily while she's working. She doesn't have to worry about a weekly injection. It's good for the next 4 months, and she's so happy with it. And a lot of women do like the pellet insertion. So that's one option. The other pellet that I was talking about is a sublingual option. So this is a pellet that's formed using testosterone, but it's dissolvable. So we're going to take this little pellet. We're just going to pop it in our mouth every morning after you get up. And over the next 3 to 5 minutes, it just dissolves, and it's taken up through the salivary glands, and it's directly deposited right into the bloodstream, and it starts working within minutes.
So I'm not even going to act like I know how this works, but so when you were describing that, it reminded me of the birth control that we get injected in our arms. Women get that.
It works very similar.
So how does the dosage? So say if the pill that dissolves in your mouth is dose A, how do you maintain that what you've got in your butt in your little injected pellet? How does that maintain? That's so weird.
Well, everybody's a little bit different, but there are some standard dosing protocols that you start with, and then depending on the results, you can change accordingly. Pellets are made so that you can put as little as 12.5 milligrams of testosterone in the buttock. There are some females that will put 125 milligrams of testosterone in. In comparison, men, if you have a gentleman who comes in, I'm putting 1,000 milligrams of testosterone in them. And that's going to get them levels of where they should be for the next 4 months. For you, if you came in, you got a testosterone pellet of 87 to 100 milligrams, you're probably going to hover around 80 to 85 with your testosterone for the 4 months. And then at 4 months, that level is going to start to drop. You're going to start to feel those changes. You're going to call my office and you're going to say, it's time for my next pellet. I need to come in. And that's what the flight attendant did this morning. She says, I distinctly remember you saying you will know exactly when that next pellet needs to go in. And she said a week ago, I just felt like I was falling off a cliff and I knew I had to get back down there to get my pellet inserted.
So it's like the magical unicorn powder.
It can be for some people. Absolutely. Why not?
Like
it's amazing.
So, okay, sorry. Here we go. Lost my train of thought there.
Yeah.
So, okay. Women, I want to tell you real quick, because this is common knowledge in the medical practice, but so I looked up, I was going down the rabbit hole of common hormone related issues, which issues can be things like obesity, irregular periods, infertility, acne, adult acne, weight loss or gain, whatever. But then also to help you kind of relate to this, ladies, the symptoms, which I'm like, oh yeah, got that, it's things like fatigue, also weight loss or weight gain, constipation or frequent bowel movements, numbness or tingling in your fingers, depression, anxiety, dry skin and or hair, and no or low libido. These are just a few symptoms. And I was seriously reading it going, yup, yup, yup.
That's me. That's me. Check,
That's
check,
me.
check,
That's
check,
me.
check.
So it sounds like I just need a good dose of testosterone. That magical unicorn punch. All right. So, and from those symptoms, the causes obviously are just what we know, ladies. We know it's puberty, pregnancy, menopause. The big three throughout the woman's life of, I said we change so many times in our lives. You know, if this was the metamorphosis, a woman would be like 97 butterflies by the time she dies.
Isn't that the truth?
It's absolutely the truth. So what can be done other than coming in and doing treatments? I mean, is there things, I guess, here, let me think what I'm trying to say. So I feel like that's a problem for me, but is it always necessarily hormones, or do you see these kind of things from postpartum depression, or is postpartum straight up hormones?
Well, I mean, I think that there's a lot of things that go into that answer. You know, after having a baby, I mean, having 3 of my own, there are babies that are simple and easy to take care of. There are some that cause so much sleep deprivation that it just turns the spiral on. We know that diet today plays a huge role in low testosterone, whether it be from processed foods, the diet that you're eating specifically, whether we're having the proper amounts of protein versus carbs versus whatever it may be. Am I isolating different types of foods that I'm not getting the proper amounts of vitamins and minerals in my diet to allow my body to do what it's needed to do? And I think exercise plays a role. We know that if patients will get out and exercise and use free weights specifically and lift and cause some muscle changes and cause a little micro trauma to the bones, we can cause testosterone to go up. The question there is, how much testosterone can I get to increase from working out 6 days a week and busting my tail in the gym? And we know that it's pretty minimal, but if somebody came to me and said, what do you suggest? Well, eating a clean, balanced diet and getting your butt in the gym is probably going to be the very best natural way to do that. There are so many people who walk around. I don't know if you know anybody like this, but I have a lot of patients who take a ton of vitamins and minerals and they have no idea why. They just take them because somebody said to, or they just think that I've just been told all these years that I should be doing stuff. Well, in our office, we do offer micronutrient testing. Micronutrient testing is a blood test that will look at your vitamin and minerals in your system, and it'll come back specifically with what you need to be replacing. And then we have a couple of companies that we do have our relationships with that will make a vitamin and mineral package based on the results. So you're getting what you need specifically. It's not just a generalized amount that may or may not be appropriate for that patient. And then the last thing that I offer patients is I offer allergy testing, and specifically food allergies. It's 298 foods that are tested. And from that, we can do elimination for food diet so that we can get inflammation out of the system, which will help your gut heal, which will help your immune system so that your body can function to the best of its ability. But we, again, in addition to just straight up hormone testing, micronutrient testing, and also the food testing for allergies is essential.
That's something that I think a lot of women don't acknowledge in their health is gut health, like you just mentioned. Gut health plays a huge role in how we're functioning in the day, and like lack of sleep and not drinking enough water. These are things that when you think
Absolutely.
of physical fitness, you're not generally thinking of things like that. You're thinking of going to the gym, getting in my miles, doing my spin class, but you're not thinking about, okay, what's my gut doing? Do you need a probiotic? Do you drink enough water? Do you get enough sleep? So that, again, I have an under 2-year-old. So right here, not happening, all of the above. I eat like a 13-year-old boy. Yeah. I have the worst diet. I'm pretty much ticking off all of these problems I have as you're talking. And I'm like, yeah, that's my own fault. That's my own fault. But I also like to look at things from the mental wellness side of it, and where you have the physical chemical side of it, as far as like, say, mom rage or brain fog or low libido, what is your opinion of, and obviously I think there's room for both things, but what is your opinion of, so let's just say low libido on one, just because it's easy to throw out there. So where you're saying testosterone levels could be the problem, maybe on the mental wellness side, they're saying, okay, you just had a baby or you have kids and you're overstimulated. And so you're being overstimulated and touched all day long. So by the time it's time to think about, hey, let's
Who
be
wants
sexy,
to be touched at that point?
We're done. I don't
Absolutely.
want to be touched. I don't want to think about being touched. Even if I'm not thinking like that, it's a subconscious thought in my brain. So what do you think? Do you think that they're always going to go hand in hand, or do you think that...
Well, I mean, during that conversation that we have with patients, both males and females, when they come in, is like you just mentioned, there are so many things that play a role in libido. Yeah, I can maximize your testosterone levels, but there are so many other stressors that play a role in that relationship. How well do you communicate? How was my day? The kids, especially for moms, I mean, that's the hardest job in the world. And if you're dealing with that from 6 a.m. until 10 p.m. and then dad walks in the door and says, hey, let's do this. And you're like, wait, I've kind of had a hard day. I don't want to do that right now. And that's happening regularly over and over and over. Then frustration kicks in. But I have had so many letters, texts, just people reaching out to me saying, thank you for fixing our marriage. And I'm like, I didn't do anything. All I did was sit down with you guys and we did hormone panels and we kind of straightened out labs. And, but people will say, well, that just made us think more clearly. It helped us have better emotions. It helped us get along better. And then that led to a better relationship, which led to, hey, I want to be with this person more. I want to be with them in a different way. So I think that plays a role. There are a lot of people too where we maximize testosterone levels, but guess what? The libido still isn't there. It just does not change in accordance with what we've done to their testosterone. In those situations, there's actually a hyposexual disorder out there. It runs quite frequently in females where the libido just doesn't change. And so to help combat that, we do have a drug that we use. It's called PT-141. It's a peptide. So this is a medication that specifically we have patients do a couple of nasal sprays about an hour before they intend to have intercourse. And what it does is it changes libido. It spikes the libido in that next hour and quite frankly, makes it so that you want to have sexy time.
So what's the difference between that and the O-shot?
Well, O-shot, it's a little bit different because with O-shots, what we do is we take your blood, we spin it down, we take all the good components of your blood in a syringe, and then we numb down by the G-spot and we inject that medicine or your own blood components into it to make it more sensitive for intercourse. Okay,
that is not at all. I've obviously not done any research. I heard the word on a different podcast, and that's not at all what I expected was coming out of your mouth.
Yeah, we actually, I've done
shot in the butt, like
some
testosterone.
O-shots in the. No, O-shots are actually injections that we do around the G-spot, and it increases stimulation. It helps get patients to the point where they can climax easier, faster, without as much effort.
So going back to the nasal spray one, Or actually not even that. So, because this could be a common for both of them. But so for the problem, if there was no libido, is that something that would be for your whole life? You've always had this problem, or is it something that would come over time because of your hormone changing?
I think there's both situations out there. I think we have a lot of patients who, with time, with stressors, with just the change in testosterone levels where it happens. I think there are a lot of patients out there too with just generally low libidos, and no matter what happens in their life, it's always going to be low. And then we have the opposite. There are a few people who walk through the door who have extremely high libidos. I check their testosterone. Guess what? Testosterone's in the dumpers. It's way, way low, but libido is not a complaint that they have at all. It is extremely high. They're happy with their libido. And so I just think, you just got to, every patient's a little different, and you have to just work with what walks in the door. And after you sit down and have that discussion of what's going to work best.
And I think you nailed it with what I was saying. So it obviously has to go hand in hand. Your mental wellness and your physical wellness, it all has to go hand in hand, because it could be one and not the other. It could be this and not that. It could be maybe you need both. There's so many different factors that luckily we're starting to get into more of the wellness side of things. You know what I mean? Like back before
Absolutely.
My generation, it was you go to the doctor gives you a pill. If it doesn't fix you, or even, you know what's worse, that I even had this happen at my family doctor that is no longer my family doctor. As
Sure.
I went in with like concerns about some things, and this was, things like a lower back pain and things like that. And he's like, "Oh, you're a new mom. That's all it is. Oh,
Just
you're a
go deal
new
with
mom.
it."
That's all it is." And it's like, what? You're not even.
No, I have
Could I have a little
legitimate
more than
complaints.
just
Please
that,
validate these. Absolutely.
Well, so that's where I was going to go with this is, so everybody's going to think I'm just like worried about sex, low libido here. No, but what about like the mom brain and the brain fog? Is that something that is related to testosterone as well, or is that something that's...
Yeah. We know that patients who have low testosterone have memory changes that are directly affected by low testosterone. The patients that one of the biggest changes that I always see when patients come back for their checkups is I'll specifically ask them, like, how are your moods? How's your mental capacity? What do you feel like changed the most? And a lot of people will say, yes, my workouts are better. I'm seeing better gains in the gym or that. But almost invariably, everybody always says, I'm focused. I can remember things that I haven't been able to remember in so long. I'm more productive in what I need to do. So I like seeing that just as much as I like people come back saying, hey, my sex drive's back, or I'm having better erections if it's a guy, or my libido's back if it's a female. My entire life changes, not just my mental aspect or my physical aspect. It's always going to be both improve.
So you touched on mood. Is that the same thing for like this mom rage? This is a new...
Absolutely. Changes. The peaks and valleys in emotions are all over the place that come with... well, for instance, I have this one gentleman in particular. If I get a text from his wife, it's usually saying, my husband needs his pellets because he's being a jerk. His emotions are not stable. He's too up and down, and he'll come in, he'll get his blood work done, and guess what? He needs his pellets in. And she monitors not by his sex drive, but how good of a husband and a father he is as far as controlling his emotions, being patient, being more understanding. As soon as that goes away, it's like I get the text saying, hey, Chris, can you do his lab work? Because he's not the same guy.
Isn't that interesting?
It's awesome.
It is, because you're like, well, I know how to fix that. It's not like coming to a doctor and
so
saying,
simple.
Something's wrong with me. I don't know how to fix it. And you're stuck with it. It's saying, well, here it is. This is going to fix it. Mm-hmm. It's the magical unicorn potion.
I've been doing the magical unicorn potion for 19 years, and it's amazing.
That's pretty. That's a pretty cool feeling to be part of people's lives and knowing that you're helping them for the better. Now, is there some on the other hand of that? Do you want to talk about that? Is there some that have been
where people haven't responded?
Yeah, I guess.
There's always, you have your people who do great. Um, I've rarely had anybody experience such negative side effects that they've wanted to stop therapy. But I've had guys come in where we've done testosterone replacement, and they say, "I don't feel a change." And I'm like, "Well, if your symptoms haven't changed because of testosterone, then we need to keep looking. We need to keep searching for the answer." Some guys are willing to do that, and some are not. If I can't fix my problems with a shot once a week, I'm not doing anything else.
They think it's going to be this magical thing that, like we're saying, it's going to be this thing that totally fixes their problems. But really, it's not helping, and there's something more to it, and they need to dig a little deeper.
Right. Exactly. There's always going to be those few where you do the normal things, but they're just not going to respond the same way as others. And so they get frustrated, and you have to help try to lead them down that next path to finding answers. And the question is, are they going to be willing to do that? And there's a very small percentage of men who will, and you have a larger percentage of women who do allow that to happen. Women are, I think, more apt to go looking versus men. We want the quick fix, and if it's not there, I tried.
Absolutely. I totally agree with that. Well, that, and also women are more, I don't necessarily want to say that we're more attuned to what we're feeling, because men, I know a lot of men that are as well, that they can say, it's my body. I know this is happening, even if
Sure.
you can't tell me it's happening, or you can't see it on the scales, or you can't see it in the blood work. I know this is happening. I do know men like that, but I do think women, because we change so often through our lives, and we're used
more apt to notice it.
Understanding and knowing when something's wrong. So
for sure,
it's a process.
And the other thing I think over the years you see is, I think women are that being where they are more willing to seek reasons for why I'm feeling this way and seek out treatment plans or change. Where guys, we're just kind of going to sit back and say, I'm just going to deal with it. I have so many guys who say, I started feeling this way 10 or 12 years ago, but it's taken me that long to be convinced or finally to decide to come in and see you. Women sometimes are like, if I'm this way for a month, I'm to the doctor. I'm not going to sit around and wait years. That's stupid. Why would I want to do that? Why would I want to waste good time with my kids or my spouse and lose out on all those good opportunities when, a simple visit that takes 30 minutes for blood work and a consultation could change everything.
Okay, you just kind of blew my mind when you just said that, because I think that, yes, women should be doing that, and I'm glad that you're seeing a lot of women that are doing that, but I think more commonly women are not getting into the doctor. They are the last person to make a doctor's appointment for themselves. They are the last person to say, this needs to be fixed and addressed. And I was actually thinking about that today, because I was getting ready to come on here and talk to you, and I thought, I want to fix this for myself. My husband wants to fix this for myself, but I want to fix it because I want to have, like you just said, you literally just came into my brain and pulled out what I was thinking while I was getting ready for this. And it's, I want to have the best experiences with my family for the longest amount of time I can do it. I don't want to be stuck.
Right.
Like, okay, so this happened this morning. I dropped my kids off to school, and I was driving back, and all of a sudden I hear this like mom screaming. I could hear this mom yelling. Like, we know the sound of a mom yelling at her kids. And my windows were up, and I was listening to a book even. And that's how loud she was yelling. And so I look over, and I'm not judging her, even though the fact was I was sick and sad for this poor little guy in the back seat that she was just screaming at. And like I said, I'm not judging, because last night I was literally that mom yelling at my little boy. I picked him up from football practice, and he spent an extra 20 minutes out there playing in the sprinklers. And I was so frustrated that I was sitting there waiting for him, and he was not respecting my time. But so here I am, the one yelling at my kid last night, and it was like a full circle moment, and I was crying. I started crying because I thought, for me to feel so sick and sad for this poor little boy that's getting yelled at, That was my son
my
last
boy
night.
last night.
And
Yeah.
it was like, I don't want to feel this way anymore. I don't want to. I see myself doing it. My husband actually points it out. Like, I'll snap, like, what are you doing? You know, and he's like, whoa
Calm
there,
down.
you know.
Did it really require that?
Yeah, it didn't require that.
Absolutely.
But I know in my brain that it didn't require that, but it just comes out. It just is like, bleh. And
Yeah.
so I want to, this is taking the steps to learning about this because I see the problem. I want to better myself. I want to have the good memories and with my family rather than be the mom that's constantly screaming at them. And if there is a way to do that, then why am I not looking into it? Ladies, why are you not looking into it? Do not let this be one of those things that you put yourself on the back burner. You're constantly making your kids' dentist appointments. You're constantly making your kids' haircut appointments. You're constantly, put your appointments on there. I've got an appointment later today, and it was the hardest thing to figure out because I'm a single mom right now because my husband's hunting. I'm a hunt widow right now. And
there you go.
It was like, it needs to happen. So it's happening. I'm going to figure it out, but it's happening. Whereas before I probably would have been like, oh, well, whatever.
I'll put it down the road.
Yeah.
Keep pushing.
Yes, exactly. So I would like to, I feel bad because you are this amazing wellness center. So the people in your area and the flight attendant from Seattle are being so well served by you. I don't know if we have anything like that here in St. George. So I need to look it up and put that in the show notes. I will be putting it in the show notes that my little brother's in Northern Utah because he does this same stuff. And it's interesting that I haven't had enough conversations with him to the point that you have completely convinced me. And I think we have a really exciting October planned. And I will talk about that a little later with my listeners. But what else can they do as far as asking questions? You guys, I know you have an Instagram page. Do you have a website as well for Nulevel?
Yeah, it's nulevelwellnessmedspa.com. In that we, with our Instagram, you can go on there, you can ask comments. An interesting part about our practice is I've been doing telemedicine for quite a long time. So I do offer telemedicine visits for people all around the country. So it's not something where you have to be in Arizona for us to be able to do your lab work, to be able to do consultations with you, to give you recommendations for treatment. I send out scripts to people all over. I mean, I have patients in Utah, California, Hawaii, Seattle, Texas, Florida, Ohio. And we arrange for lab work to get done. We can drop ship testing kits to you. Some of those are just what are called blood spot tests, where you just prick your finger and then you send the box back in. I can send you a lab referral and then you can take that into your local lab, get your labs done. And then, usually it takes 7 to 10 days to get those results back at a normal facility. And then we do a telemedicine visit. That can be via video, or it can just be like a regular telephone call where we sit down and we review the labs, and I basically go over everything and then give you recommendations. And then from there, the treatment plan's made and off we go.
That's so true. I didn't even think about that. That's amazing. I just got so excited for everybody listening to this because now they can come and just talk to you about it because that's true.
Absolutely. I'd be happy to send out referrals for those lab work to get completed. And then, like I said, it's an easy conversation via phone or a telemedicine via video. And in 30 minutes, we can have a plan in place and get it rolling. So it's so simple. So many people don't take advantage of telemedicine today, where you can seek out specialists all over the country for certain things and you don't have to travel. Just pick up your phone. That's awesome. Thank you so much. I really appreciate you coming on here, and I think you're going to be seeing a lot more of me, so I'm really sorry. I'm really sorry, I'm okay Chris. With that. We can deal with it. We can make this a good thing. Yes, you're going to be our what did I tell Janie? You're going to be our
local Dr. Oz. What is that? Oprah had Dr. Oz. This will be
Oh, yeah.
Chris is our
Perfect.
in-house specialist.
In-house Dr. Oz specialist. I love
Well,
it.
thank you so much for taking time out of your, I know, very busy day, Chris. And I loved everything you said. I know my listeners got a lot of information out of that. And I can't wait to hear from you again. Thanks for being here, Chris.
Awesome. I appreciate you for allowing me to be a participant today. Thanks so much.
Bye, Chris.